Great, welcome everyone. I'm Susan Hockfield, President Emerita of MIT and a member of the MGB board. Now I can be reasonably certain because of the title of this conference that there is no one in this room who doesn't appreciate today's incredible promise and excitement of gene and cell therapy. Last night there was a gathering of speakers and we were kind of reflecting that even as recently as 8 years ago, the things we're talking about today were more in the realm of science fiction than science fact. So this is a field that has moved incredibly quickly now, beginning to deliver on the promise of new ways to diagnose and treat disease. So we have no better group than the 4 panelists on the stage with me right now, all of whom played important roles in fostering and planning this 2022 World Medical Innovation Forum. They're going to give us their perspectives on both the forum and the promises of gene and cell therapy. Rather than do formal introductions, I'm going to allow each of them to introduce themselves as they address the first question. And I've also encouraged them to interact with one another as we move along so they're not just answering my question, but actually talking to one another and to all of you. So let's get started. So the first question I'd like to tee up is to ask each of them what excites them most about this field and where do you see the most promising opportunities? And we'll just go down the line this way. Miceal, why don't you kick it off?
Okay, good afternoon everyone. I'm Miceal Chamberlain from Bank of America. I serve as the president of Bank of America here in Massachusetts, and I also head up the Northeast for our commercial banking business, which we define as companies that have revenues from 50 million to 2 billion, all the way from New Jersey up through the New England states. And as president of Massachusetts, my job, as Brian would say, although he's the CEO and lives in Wellesley, he wants the market presidents nationally to be the CEO of their region. We're a big global bank. We have 208,000 people. Here in Massachusetts, we're 4,000 strong. And as the president here, my goal is to deliver the bank to our local customers, to our teammates, as well as to our communities. So everything that Brian and the executive team are leading across the globe, it's up to the market president to bring that strategy to life here in Massachusetts and especially in Greater Boston. And Susan, to answer your question, I think, first of all, it's all about improving patient outcomes and the patient experience. We heard a little bit from Dr. Klebanski and Brian about how we as an organization are thinking about that, but of course how MGB is. And if I think about it from the lens of Bank of America and what are the opportunities, I'd say first, and Brian mentioned this, we have an incredible research franchise that you and the audience will be able to interact with during this conference. Just in healthcare alone, we have almost 50 analysts covering well north of 500 public equities. And with that expertise, we hope to deliver some insights to you all today. We're hopeful also we'll bring away a lot of data that we can use in our research analyst pieces going forward. I'd say second, what I think is a great opportunity is you can't have innovation without capital. And we have a tremendous amount of balance sheet and capital that we deliver to our customers every day on the corporate side. We have more small business and middle market relationships than any bank in the country. So it's really how do we provide that expertise, the sought after advice that these companies are looking for in their growth stage, and really plugging them into alternative sources of capital so they can grow. I'd say those are the two of the key things. The final thing I'll lead with is really back to the client experience. We think there's a tremendous opportunity to further digitize the healthcare space. We think there's an opportunity to make healthcare more equitable. Brian touched on it a little bit before. We're focused on that here in Massachusetts with the Mass League of Community Hospitals, among others. And really, how do we help lower income communities get the health care they need so they can be on the path to economic mobility. And the final area is really around ESG. It's really, we embed ESG in the bank and how we operate every day. And we think we can help provide some of that expertise to companies as they go on that voyage and life cycle.
Terrific. Marcel?
Yeah, thank you. So I'm Marcela Maus. I'm the director of the Cellular Immunotherapy program at the Mass General Cancer Center, an associate professor at Harvard Medical School. Most of the time I spend running a lab that makes new forms of genetically modified immune cells to treat patients with cancer. I think, in regards to your question of what excites me the most about gene and cell therapy, I didn't think I could be excited about something for as long as I have. I've been in the field since 1999. And what is so exciting about gene and cell therapy is that it's potentially curative. There's so many things in medicine where it's palliative or where we sort of treat symptomatically or try to modify the outcome of disease without really getting at the fundamental mechanisms of what's going on in the disease. And you can get at that with gene and cell therapy. You can potentially edit a gene and fix it. You could potentially add in a corrective gene. You can kill tumor cells with a non-overlapping mechanisms that doesn't require the cell to be sensitive to chemotherapy or to have the same kind of resistance mechanisms that occur with either targeted therapies or with chemotherapies or radiation. And so I'm just really excited about that possibility of cure and that possibility of designing a cell therapy or a curative therapy even after multiple other things haven't worked. And when you find those mechanisms of resistance, you can design around them and make next generation forms. It's such an incredibly flexible platform for treating patients sort of with the issues that they are facing, with the disease, the particular disease that they're facing. And so I think the possibilities are endless. I think sometimes that's the challenge, is that there's so many things that you could potentially do. And so trying to focus and design for a particular patient versus a large population can sometimes be a challenge. But I think the world is our oyster in this field, and that's what I think is just so exciting.
Geoff.
Thank you. So my name is Geoff Meacham. I'm the Senior Biotech and Pharmaceutical Analyst here at BofA. I've been a sell-sider for over 20 years. I've seen the innovation across the space over several decades, and I would say I echo the sentiments. I mean, I definitely think that gene and cell therapy, the disruption, the transformational potential, to me is what's really exciting. We have a number of de-risked products out there today that are mostly for orphan genetic diseases, but we're moving towards bigger indications, and that's what excites me is as we go from a rare disease to, say, cancer or, say, a bloodborne disease, and then going forward, what about CNS? Do we have we have exciting therapies for Alzheimer's. Eli Lilly just had data last week for an exciting therapy for obesity. We're not there yet in terms of leveraging gene and cell therapy, but we could get there, I think, pretty quickly. And as was mentioned earlier in the prior session, the faster we can do this, the more we can maybe start off with disruptive, curative type of therapies that are lower cost. And over time, I think we're going to be able to figure out how to maximize that. But that to me, though, is to take a step further, is to say, we have novel technologies, we have next generation technologies in gene and cell therapy, and we've done it for a number of smaller indications, but broadly in cancer, broadly in neurological diseases, that affects, human health, I think is really, that's the most exciting part to me.
Ravi, you bring a perspective from being in this area a long time, being away and coming back. So tell us what is most exciting to you about this gene and cell therapy theme.
Thank you, Susan. So the reason I'm excited about this area is because it allows Mass General Brigham and other major academic medical centers to actually deliver on the promise that we continue to make. When a patient comes to any one of our academic medical centers or hospitals, she is expecting the best standard of care for whatever illness she has: coronary disease, stent, a way to protect her kidneys if she, for example, has diabetes. But when that standard of care is not available, what she's expecting from us is the promise to give her access to the latest therapies. And if they're experimental, then we need to be transparent and share those opportunities with her. And what gene and cell therapy does is it allows us to deliver on that promise. In a very transparent way, the patient becomes our partner. Miceal talked about clients as partners. Patients are our partners. And as partners, we then move into this journey to bring these therapies to the clinic. We do so in an academic environment. We do so because that's what we are here to do. We're an academic medical center. So why am I excited? It allows us to deliver on that promise. You heard from Marcela about how these therapies are potentially curative. Of course, not all of these therapies are curative, but of course the potential for them to be curative exists. And that's what's incredibly exciting. To do so and share that journey with the patient in a transparent way, in a way where we're building trust with our patients, in a way that we can be honest about what to expect, realistic, understanding the risks and the benefits. That's what we do every day with all the therapies we deliver. And what gene and cell therapy does in this environment, at this time, if you will, in the age of medicine, is it allows us to deliver on a promise where potentially we can cure some of those diseases.
Yeah. So you all have spoken about, let's just say what we can expect to see in, probably, I would say the middle to somewhat distant future. One of the things that, I was thinking about as I was going through the program for this meeting is, what are the sessions? What are the new things that I'm going to hear about that I haven't yet encountered? And so why don't we reverse the order and each of you reflect on, what are the things that you're most looking forward to hearing about in the next few days? Where are the areas that the investor community has their brains finely tuned? And also from a research and healthcare perspective, what are we going to hear about over these next several days that might surprise us, might excite us, might depress us? Ravi, why don't you start?
Well, I'll get to what depresses us in a second, but first we're going to start about what excites us.
Optimism first.
Optimism first. Why am I excited about these next few days? You heard even from this morning where we had back-to-back incredibly exciting scientific presentations on some technology that one could only imagine and dream of. We heard about different ways of delivering gene and cell therapies. We traditionally think of viral vectors, for example, and we saw other ways of delivering therapies. We understood that certain diseases that were not even being able to be tackled years ago, now being tackled. We heard a wonderful talk on mucopolysaccharidosis type 4. I have to just make sure I say that correctly, right? That's what's exciting about these next few days. The opportunity to make a difference in those diseases that otherwise either had been neglected or we had no therapies necessarily to deliver. What else are we going to hear? We're going to hear the patient perspective. We're going to hear a little bit about that today. We're going to hear certainly more about that tomorrow. What are the patients looking for? What do they need? What are they looking forward to? And how can we engage, as I mentioned, with them in a partnership? And then we're going to hear the perspectives of industry and their challenges, not just in the field, but also how can we work as partners together to bring some of these therapies forward. So a number of those components are going to be touched on throughout the next 48, 72 hours, and that's what I'm looking forward to.
Great. Geoff, how about you?
Yeah, I've heard just this morning, that I agree. Some of the scientific, the presentations this morning were really very leading edge. They talked on a lot of issues such as cancer resistance, such as going after novel modalities for rare diseases. But I think that, in my opinion, though, looking over the next couple of days, though, just the whole range of indications of diseases that could be addressed with pretty difficult patient populations. I think the challenges, though, are we still have to answer questions on regulatory. We still have to answer questions on manufacturing. So the next step, we can take something from the bench, but can we go to the bedside? And then from beyond that, how do we get these things approved? What is the endpoint? What is, and then broadly, how do we make a drug like this a curative intent therapy for the masses? And so I think we've benefited from a lot of technologies over the past, say, even 5+ years that in my career is eons, just years better than just, I don't know, even 20 years ago. But I think going forward, though, we really have to take advantage of how novel and be creative about how we can, get these drugs to market and to be approved in a safe and an effective way.
Yeah, important, thank you. Marcela.
Yeah, I am looking forward, I guess, to two main things. One is I actually really enjoy these sort of chats to hear what leaders in the field are thinking about, what's on their mind. It's very different than trying to absorb like tons of science and data and just pontificate about where the field is going, what are our biggest challenges, what are we most excited about. And it includes everything from the science to the manufacturing to the regulatory to commercialization to how do we make this accessible to patients. And then the second part is engaging with you. Individually, I think I probably know many of you in the audience. I can't quite see all your faces right here, but how do we work together as academic medical centers, as an academic medical center, as scientists, as physicians, in the industry, in people who provide capital, in investors? How do we work together to really make this a successful field? It has been going through in a period of incredible growth in the last 5 to 10 years. I think it's cooled down a little bit now, but the excitement really shouldn't. And I think that there is still so much untapped potential, and trying to figure out sort of what are the optimal ways to address all the major challenges in the field, from science to equality of access, to manufacturing, to regulatory, to just enabling this to happen on a larger scale. And I think Boston needs to be in the lead for this. We have everything right here. We have the investors, we have the biotech industry, we have the expertise, academic, scientific, and clinical, that really coming together to be able to do this is, I think, going to be transformative, and I'm excited to talk with you.
Miceal?
Yeah, I think the key thing I'm looking forward to, and Marcela talked about, is accessibility. We have 3 experts here that are going to get in the weeds on all the technical terms and everything that we're going to learn in terms of cell and gene therapy, but a lot of that's going to go over my head. But really, I think if you look at COVID and the experience we had here at the bank and all servicing the communities we do here, it was obvious that COVID, again, the biggest impact we saw were from low-income communities that couldn't get access to health care, and they couldn't get a vaccine, they didn't know where to go, they didn't have transportation. So how do we take this another level once we have all these therapies? How do we get them to the communities that need it most? Because again, at Bank of America, we really are focused on economic mobility, and so the group that needs it most is having the trouble accessing it most. So how do we get to them? And then how do we get a feedback loop from those customers to ensure that these drug companies are incorporating them into everything they're doing in terms of drug discovery?
So all of you have touched on something. One of my favorite themes is regional advantage, and it's a term I got from Annalise Saxenian's book. And it seems to me that each of you has spoken to some of the benefits of being in this community. Certainly, gene and cell therapy isn't something that stops at the perimeter of Greater Boston or the perimeter of Massachusetts. But it does seem to me that we have extraordinary assets here, and often those assets are siloed. But as I said, each of you has commented on the power of being together in the region. And I wonder if any of you would like to engage with the question of how do we take advantage of the components of the system and create something here where the whole is greater than the sum of the parts. And we talk about this across institutions. Ravi and I were together at another kind of conclave around the use of AI in healthcare earlier this week that bridge the river, which is, you think you could drive across it, but, you can drive across it, but the ideas don't necessarily cross. And figuring out how we can amplify the power of this region by connecting all of the components, including the investors, the banking community, with the academic and healthcare delivery organizations. And I'm sure each of you has thoughts on this. As I said, it's one of my favorite themes because I think that Boston, Greater Boston, is almost uniquely positioned to accelerate advances that will bring us to a new kind of future. Yeah, Ravi, go ahead.
I can certainly start. So look at the constituents at this meeting, thanks to the organizers, and Chris and his team and others. We have investors, we have industry, we have academics, and we have leaders in all of those sectors here. Going back to some of the comments made earlier, this meeting is not just about the successes, it's also about the challenges. Those challenges aren't easily met by a single constituency. They're met actually by partnerships. They're met by teams coming together. You heard some of the challenges early today in terms of what those investigators are trying to bring forward, and essentially they're looking for a partner. They're looking for a group of individuals, investors, industry, and vice versa, to say how can we actually tackle the problem and get this to the finish line. And that's what this ecosystem allows us to do. And all of those constituents are here at this meeting for that reason. And I think the meeting is set up so that there is not just accidental, but purposeful, if you will, interaction to solving some of those problems.
Yeah, I might expand on that by just saying, we can't do it alone. It can't be just capital that does it. We need innovation. We need partnership from public, private. We need nonprofits. Everybody has to be aligned in this ecosystem in order for it to work. And so that's what really attracted us to be the sponsor with MGB in this conference. We've been looking to do something in Boston that's been differentiated and that would combine all of these different areas that Ravi just talked about. And this partnership makes the most sense to me because we've known MGB for so long. They've been a core partner, and never mind they're the leading hospital institution perhaps in the world. So starting with that and then plugging in some of our expertise and partnership, to me, you don't have to walk out the door here and you'll see some of the most renowned and leading hospitals in the world right here. We have access to talent like no other city. So having it here in Boston makes a ton of sense. You have 100 universities inside of 495. So you got talent, you've got expertise, you've got research, and you've got capital formation that can help companies grow. So we're thrilled to be sponsoring this event, and couldn't do it with a better partner, and I think everybody does feel aligned at this conference.
I'd say I'd like to, there's a great culture here in Boston of collaboration among academic centers, also with industry and the capital. What I'd like to see sort of outside looking in is really, the delivery of novel medicines, of care to the community, to the broader community. And I, as an analyst, I don't really see that very often. You don't see a lot of studies that, that show real-world experience and what benefit, economically or otherwise a new drug may have, or a new modality or a new therapy may have. And so that may be something going forward to kind of think about.
It's an interesting question. I think the issues of cost of development and the individual sort of drug cost of a gene and cell therapy product, is different than is higher than many other medications or interventions that are done. And I think we have to figure out a way to make it accessible, because none of us are interested in innovating just to be able to treat a mouse or to be able to treat one very wealthy patient. The idea is to make these therapies accessible to those who need them. And I think that is going to require partnerships and being aligned, as many of you have already said, about what our true goals are. Mm-hmm. And I suppose one thing that has a silver lining, if one can call it that, of the pandemic is that I do think that it has broken down some barriers in terms of interacting with people, whether they're far away or whether they're in a different industry or a different building. And I think I'm very excited about MGB is building a gene and cell therapy sort of center that is going to be put together to enable these sorts of collaborations and to break down some of those barriers and silos that may have been here before. I think that the pandemic kind of started it in terms of breaking down the barriers, and I think it's up to us now to keep them at bay and to enable us all to collaborate together to bring high-tech innovation, but also in a way that's equitable and accessible.
Another thing that we hear about, and we certainly have heard about it through the pandemic, it's been emphasized, as many of our disparities have been emphasized, that one of the places where I just feel very proud about MGH and MGB is, access to care, no question, everyone buys in, but access to the participation in care, access to the participation in the investment community. So I think that's someplace else where we paid attention to in the past. It kind of comes and goes, and kind of doubling down again on being sure that we have opened the intake to our institutions, all of our institutions, to young people who might not kind of think of themselves as a biotech investor when they're in grade school or high school. I think that's really important. Not to go too doom and gloom, I always have to remind everyone that the Greater Boston was where it was happening at the beginning of the digital revolution. And then it wasn't anymore because of any number of factors which various people have analyzed. And to be on the cusp of the next, in my mind, the next big industrial transformation, which is bio-based, and to see all of the activity, as you say, in Greater Boston. I think one of the questions for us is, kind of to look ahead. Gene and cell therapy, I think, provides a really great kind of runway into, kind of next-gen healthcare, next-gen health preservation, next-gen financing. And are we ready to continue, to maintain our lead? What are the dangers? So where should we be kind of looking over our shoulders to be sure that what we have in terms of bringing our resources together to invent the future will remain as strong as they've been in the past?
I might just comment quickly on that. Hospitals in general are risk-averse organizations, just by their very nature, as they should be. This particular field and where we are in terms of research, we are pushing the boundaries, but we're pushing the boundaries for the right reasons. We're doing so in a responsible way. But what allows us to do that is because we are in this ecosystem, going back to your point, Susan, that when we interact with industry, whether they be across the river or on the same side of the river, they're helping us to push those boundaries because we're understanding their challenges and they're understanding our challenges. And if we do so, we're actually helping each other move forward. And one can imagine in the absence of that kind of ecosystem, we may not be pushing those boundaries. Going back to your point, how do we actually maintain a leadership position here? It's making sure we push those boundaries, but doing so in a responsible way, doing so in obviously a transparent way where we can bring our patients along. But understanding the challenges on each side, if you will, of the river are really key. And interestingly enough, we can hear about those without necessarily traveling too far. You can actually probably hear about this in a conversation at a restaurant more than you can actually at a meeting like this. But that's what this ecosystem allows us to do.
Yeah. Any other thoughts about the power or the lack of power in the region?
I would say, sharing of data for sort of the mutual good. So when there have been some setbacks we have seen in the gene therapy and cell therapy space. We've seen a number of clinical holds. I think we've long been past the Jesse Gelsinger of the world, right, which happened a while ago. But we have leading edge technologies that I think are gonna require a little bit more of an analytical tool to it, of a data-centric model where we all may benefit. Companies and the academia and the industry alike may benefit from having sort of a common ground of information where we may be able to develop things faster, or we may be able to de-risk an asset faster. And I think that's obviously going to be pretty helpful when we talk about the sheer number of therapies that could be coming to the mix here in the next decade.
Right.
And maybe from a capital standpoint, I just think we're at an interesting point of time. All you have to do is look at what the NASDAQ's done year to date and access to capital in terms of
how... You said no gloom and doom.
Yeah.
I'm going to try and finish on a bright note. But
he's going to bring us up. I'm sure.
But what that's done is that easy access to capital, and what it's done to the community here in terms of real estate and lab space and employment and everything else. So we're at this interesting point of time where as rates are going higher and growth stocks get a lower multiple, what are going to be some alternative sources of capital to help keep some of this innovation alive? And how can you work with your banks to really understand what your options are and how we can keep things moving through the pipeline and ultimately getting to market. So I just think we're at an interesting inflection point. I'm hoping we're closer to the end than the beginning, but the first 50 basis point rate hike's probably coming tomorrow with a few more to come. But I just think for us, this is another great time for this conference to be able to talk about this, and we'll talk about real estate, we'll talk about capital and some of the other panels, which I'm really interested to hear more about.
Yeah, so let me just close out by saying what a fabulous opportunity this conference is. I want to thank the organizers by bringing such a diverse group of people together and just encouraging you all that as you're wandering around and, you know, through the corridors, you know, talk to the people you don't yet know, because we have an incredible opportunity here to invent a better future for everyone. Thank you very much for joining us this afternoon.
Thank you.
Thank you.
Thanks, Susan.